Work Wellness Institute is transforming research into workplace performance and health. As an organization, we function throughout the complete cycle of turning research into practice, mobilizing knowledge as a research institute, community partner, funder, and educational provider. Our mission of creating safe, healthy, and inclusive workplaces for all is our driving motivation. Learning is a lifelong journey to adapt to the forever changing needs of the workplace. Whether you are a leader, a professional, an academic, or a student, we provide high-quality resources that are evidence-based, topical, and relevant to all industries. Choose the Work Wellness Institute as your learning journey partner and become a member to gain full access to our diverse knowledge mobilization programming, including lectures on demand, e-curriculum, 3 distinct certification opportunities, and more. Continue to learn and connect with the Work Wellness Institute and see how we can support transforming research into performance and health for your workplace.
Okay, now more than happy to be moving into our main presentation today and introducing our experts today and a partner of Work Wellness Institute. We've been fortunate enough to work together before, Dr. Gulseren, who works as an assistant professor at the School of Human Resource Management at York University in Toronto, Canada. She is also the chair of the Canadian Association for Industrial and Organizational Psychology. As an expert in healthy work, she studies healthy and safe work, leadership, and sustainability. She also teaches occupational health and safety. Duygu obtained her PhD in Industrial and Organizational Psychology. She also holds a master's degree in psychology and a bachelor's degree in chemical and biological engineering. Prior to her academic career, Duygu worked as an HR consultant, and in addition to her academic publications, her research has appeared in various media outlets such as Harvard Business Review, Psychology Today, and Canadian HR Reporter. We're so happy and appreciative for you joining us today, and I'm happy to pass the baton over to you for today's presentation.
Thank you so much for the introductions, Elizabeth, and hello everyone, and welcome to today's session. So today I will share the findings of a study that I conducted in the last year, and this is a leadership training. So we developed and evaluated a leadership training for employees with chronic pain, and this study has been generously funded by WorkSafe BC. And I'm also so happy to be partnering with the Work Wellness Institute in the execution of this project. Before I start, I just want to say a few words about my work so that it makes better sense why I did this study and where I came from with how I came up with this idea. So as Elizabeth introduced, my research has 3 major streams. So I study leadership, particularly leadership in terms of creating occupational health and safety, healthy and safe work. And within that realm, most of my work is centered around work disabilities, particularly chronic pain disability. And I also do a fair bit of work on sustainability in the workplace. And when I conduct research, as researchers, we can use different lenses. And I use 2 different lenses. One of them is the theoretical lens, which is about knowledge production, more like academic work. And that is more about developing theories and contributing to the theories. There's also, I also use an applied lens in my research, and it is more about the practical implications of it, or the more practical side of it, to create impact with what we know on this topic. And today's work is studied from an applied perspective. So my goal was to create a positive impact in organizations, in the lives of employees with chronic pain. And it is at the intersection of the leadership and healthy safe work research realms. But before I start, I'm just curious about your motivation. So what made you just join today at this time of your day? Could you just type it in the chat box? You'll see the chat box, and Elizabeth already shared the FAQ with you. So if you could just, and if you feel comfortable, of course, can you just share a few words about what motivated you to join us today? Okay, as you type, I might also show you some options, and if it's easier for you, maybe you can just type in the number. So, the first option is to learn about chronic pain and leadership. The second one is improve transformational leadership skills. And the last one is gain insights from a leadership program. But of course, your motivation doesn't have to be limited to those three items. It's just a shortcut for you if you just would like to copy, just type the number. Okay, and Tonya said professional interest is a return to work coordinator supporting employers with ideas to attend to chronic pain employees. Excellent, thank you. And thank you both for sharing. So you might continue with typing maybe, and I'll just make sure to read it when I see, but I'll also move to my next slide, which is about the objectives of this session. So, ideally, by the end of this session, you should be able to explain the connection between leadership and chronic pain. And we'll discuss more about this. But leadership is typically acknowledged as an important part of employees' chronic pain experiences, but it's not. It doesn't receive as much as attention it deserves. Revise and appraise the transformational leadership behaviors in the workplace, particularly your own transformational leadership. Gain familiarity with the leadership program that we specifically designed in this area, and articulate the inclusivity and performance outcomes of this training program. So if you are able to do all the four by the end of the session, I'll just consider myself as a successful speaker who has achieved her goals for the today. So let's get started with the basics so that we are all on the same page. So probably you are here because you know what chronic pain is, or chronic pain is an important concern for you. But I also, in my research, I noticed that people sometimes have different definitions of chronic pain, and sometimes people with real chronic pain does not identify themselves as someone with chronic pain. But indeed, it is the definition is quite broad, and many of us fall under this umbrella if you think about it. So, chronic pain is pain that is persisting longer than the usual healing time of a tissue damage. I know this sounds very academic, but when we actually try to measure chronic pain, we measure it as pain persisting for 3 months or more. And this can be a continuous pain. It can be a recurring pain. It can be, it can ebb and flow. It can come and go. The level doesn't have to be very severe all the time. But if you have pain concerns for 3 months or more, you are probably a person with chronic pain. And this is a topic that is studied in research from different perspectives. So doctors study chronic pain, physiotherapists study chronic pain, psychologists like me, HR professionals or scholars study chronic pain. So many people are interested in chronic pain in the workplace. And when you have people from so many different disciplines, it's usually difficult to find a common ground. But interestingly, in chronic pain, there's a fairly good amount of agreement on the biopsychosocial model. And that means pain is not a purely physical, biological experience, but it also has psychological and social components. And in very extreme cases, you can even see people who show no tissue damage, but still report high levels of pain. Or sometimes you can see people with severe tissue damage, but they don't feel chronic pain. And this is because how they think about pain, how they think about life, even their philosophy of life, as well as people around them, like connections and support systems, they all can affect how we feel the pain or perceive the pain. And as I said, this is not an uncommon experience, and different depending on the definition. Of course, the prevalence rates show differences. But in research, we know that about 25 to 40% of all adults worldwide are suffering from chronic pain, or at least reporting chronic pain. And like, especially if you think about the 40%, like probably at least, if you're living with another person, at least one of you have chronic pain. And in the disabilities realm, we are particularly interested in chronic pain, and this is because it is the leading cause of work disability, and it's also one of the leading causes of insurance claims for disability claims. And the prevalence rates also show that this is rising. So what the 25 to 40% that you see on my screen will probably be different in 10 years from today, and it will be higher. And as I said, as an HR scholar, I'm interested in chronic pain in the workplace because research shows that this affects people's lives, employees' lives, as well as organizations to a severe degree. But it's not the pain. It's like when we look at from a social model of disability, it's not the chronic pain itself that is creating the negative effect. It is the mismanagement of chronic pain, or ignoring pain, or just not meeting the needs of people with chronic pain. But based on past research, we know that employees with chronic pain have report increased healthcare costs to attend their pain-related needs. This is also paradoxical because sometimes they may not feel well enough to work, but also they feel obliged to work to be able to keep up with the medical expenses, or to have access to benefits. We know that people with chronic pain may report reduced work performance, depending on how they manage the pain. And we also know that mental health issues are one of the biggest correlates of chronic pain in the workplace. And when it comes to the organizations, the picture is very similar. So, in organizations with high numbers of employees with mismanaged chronic pain, we see higher rates of absenteeism, we see significantly high insurance costs, and we also see reduced productivity at the organizational level. Okay, so you probably see it on your screen, but I'm just curious about your confidence level, about your knowledge of chronic pain in the workplace. Awesome. Thank you for participation. And as you can see, the majority of our audience members just said they are somewhat confident about their knowledge. And this is the 80% of our audience today. And the 20% was neutral. So they neither felt very confident nor um, inconfident about their knowledge. Awesome. So we are working with a group who feels confident. And this time, I'll just ask, what do you think is the biggest barrier for employees with chronic pain? And you'll see five options on the screen. And if the options that I presented doesn't cover your perspective, you might also want to type it in the chat box. Okay, so the 40% of us thought lack of leadership support is the biggest barrier. 20% thought it's the workplace stigma. Another 20% thought is the fear of job loss. And the other 20% said lack of awareness about chronic pain. Thank you very much for your participation. So we'll talk about all these points today. And I'm just moving to my next slide. So you'll see that the title of my slide is "What is the common ground?" So this is a term, a fancy term, I believe, that we use in research to refer to what we know about chronic pain in research. So far, as someone who reads the literature like me as their job, they'll, when they read the literature, they will see three streams of research, or where the research is concentrated around three key themes. One of them is medical referrals. So it's about who is taking care of pain, how about the treatment options, how about interdisciplinary teams, it's just looking at pain medical referrals from different perspectives. There's also another stream of research that that talks about benefit support. So what are the, what kind of benefits can organizations provide? What is the use of those benefits? Are they effective or not? So there's lots of discussion on this topic too, especially in the compensation and area. And lastly, probably the vast majority of research in this area is about chronic pain self-management programs. So employees with chronic pain are usually, when the workplace intervenes, that intervention is usually in the form of assigning a training program to employees, and it's about how they can learn about to take care of their pain and their work, and the employee is expected to go through those training programs and just improve their own pain or better manage their pain. But as you can see, particularly in the last item, there is an unequivocal emphasis on employees' responsibilities, or the onus is unequivocally um, put on the employee side when it comes to managing pay. And but we also know that organizations and leaders, particularly if you look at from the biopsychosocial perspective, we know that there's lots that organizations and leaders can do about this issue. We know that leaders have the authority and the capacity to change the work conditions of employees. So they can redesign your work. They can provide accommodations. They can change your relationships. They can provide flexibility. So they can change your whole work experience, which can affect your pain or work ability. They can also provide key support. They can, provide resources for you to better take care of your pain and work. But unfortunately, many leaders often lack pain literacy, and that's why I believe they just may not be able to use the tools that are available to them when it comes to managing chronic pain. So chronic pain is an important concern for my organization. Do you agree with this statement or not? Or do you just, would you like to learn more? Okay, so 60% said this is an important concern for their organization, and 40% would like to learn more. Can we go to the next question? I have the skills to effectively address chronic pain in the workplace. Yes, no, I would like to learn more. Okay, 20% said yes, 20% said no, and 60% said they would like to learn more. How about the next question? I want to learn to help employees with chronic pain. Yes, no, not applicable to my role. Awesome. 100% said yes. Thank you very much. So I asked those three questions because these are the exact questions that we asked to 500 American business leaders for a Harvard Business Review article that we prepared. So we surveyed them, and exactly the same questions were asked them. And they're similar to our percentages. The 80% of them said that chronic pain is a concern for their organization. And 20% said they have the skills to deal with chronic pain in the workplace, but 78% of them wanted to learn how to help employees with chronic pain. So if you just look at the slide, you'll see a great gap between what we value, what we know, and what we want to know. And this table itself, like this chart itself, was the biggest motivation for us to come up with this training program, because we learned that leaders would like to know and they care about employees with chronic pain, but sometimes they just don't have the knowledge and the skills to intervene when they interact with an employee with chronic pain. And when we wanted to design a training program, but when we design such evidence-based programs, the first starting point is to go back to the evidence. And by evidence, I'm talking about not just one study, but a collection of studies that would guide us in the correct direction when designing the training. So you might see a number of different, training programs outside, and I'm not saying that they are all not evidence based, but some of them are not. So some of them are just, may not utilize the available research out there, or they may not measure the effectiveness of their training. So we may not have enough information about the usefulness or the effectiveness of the program that we design. So as a researcher, it was my responsibility to go back to the research, to find the best practices, to bring it back to the classroom. In this case, it's an online classroom, and I'll just share more details in a minute. And then not just provide the training, but also the measure effectiveness of this training program. And one of the very well established findings in the literature is that transformational leadership style, its particular leadership model, is actually quite effective when it comes to health and safety outcomes. So it is generally highly correlated with positive health and safety outcomes. So employees working with transformational leaders report better health overall. They also report improved work environment. And we also see that transformational leadership can be associated with reduced costs and increased productivity. So to me, this was the perfect picture that gave me enough direction to go with the transformational training model. Okay, so now we will ask 8 questions back to back, and you'll see some statements about leadership behaviors. And there's a reason, so I'll just answer that first, and we'll come back to what those questions were trying to assess. So I remind the value of my work to my employees with chronic pain. Definitely agree, somewhat agree, completely disagree. Excellent. So we have 50% 1, 20% 2, and 20% 3. Can we go to the next question? I'm a role model when it comes to finding a greater meaning in pain. Definitely agree, somewhat agree, completely disagree. Okay, 60% 2 and 40% said 3. All right, let's move on to the next question. Thank you. I draw a positive picture about the future for my employees in pain. Definitely agree, somewhat agree, completely disagree. Awesome. 50% said 2, another 50% said 3. All right, let's move on to the next one. I motivate my employees to invest in their work and pay. Agree, somewhat agree, completely disagree. And this time we have a very equal distribution. Let's move on to the next question. I encourage my employees with chronic pain to seek new ways to manage their pain in the workplace. Definitely agree, somewhat agree, completely disagree. This time we have 75% that gave 2 to this answer, and 25% that gave 1. Thank you. And the next 3 questions. I challenge my employees about their beliefs on working in pain. Definitely agree, somewhat agree, completely disagree. Okay, 50% said 2, another 50% said 3. Thank you. Next question. I listen to my employees when they share pain related concerns. Definitely agree, somewhat agree, completely disagree. Excellent. A huge 80% said 1, 20% said 2, and 0% for 3. Next and last question. I check in with my employees about their pains. Definitely agree, somewhat agree, completely disagree. Awesome. This time we have a more balanced distribution. 40% of us said 1, another 40% said 2, and 20% said 3. Thank you very much. So I'll just explain what these questions mean in a minute. The questions that you answered, actually, I came from a transformational leadership scale that we used in the study for pain-focused transformational leadership behaviors. And you probably notice, but different sets of questions tapped into different aspects of transformational leadership. And these aspects are those four behaviors. So transformational leadership by definition is empowering positive type of leadership. So Transformational leaders do not only like manage their employees, but they inspire for a positive vision. They empower them and they motivate them for a positive living. And it is defined in four categories of behaviors. And these are, I know the names are long and maybe difficult to remember, but idealized influence, that is about being a role model. Inspirational motivation is about drawing a positive vision for the future. Intellectual stimulation is encouraging the common assumptions and encouraging for positive, innovative solutions. And individualized consideration is about paying personalized attention to each and every one of employees. Based on these four categories, I'm just curious about your thoughts. So, which transformational leadership behavior do you think has the greatest impact on employees with chronic pain? It doesn't have to be the research answer. I'm just curious about your personal thoughts. Is it the role modeling? Is it the hope and shared vision? Is it creative solutions? Or is it the personalized support? Thank you. And I see that a 60% of us thought individualized consideration is the most important transformational behavior in chronic pain, and another 40% thought it is intellectual stimulation. Thank you very much for your participation. And let's see what we found. So, I conducted another study on the transformational leadership's impact on pain's interference with work for a group of employees with chronic pain. And I saw that employees who work with the transformational leadership has actually reported decreased interference. Their pain interfered with their work less when they work with the transformational leader. And this is because transformational leaders gave them confidence about managing their pain. So that's what we mean by pain self efficacy. And they also gave them hope. So, with increased hope and increased confidence in pain management, they were able to uh, manage their pain without interfering with work. And like we particularly chose this pain focused leadership approach because, as I shared before, the previous work on pain management in the workplace put so much onus on individual employees. So we wanted leaders to take more responsibility in addressing this issue. And in this study, which I will explain in more detail in a second, we actually ask 5 questions. So we asked, can we really teach leaders learn about pain focused transformational leadership? And will this, if they can learn or if we can teach, will this reduce their stigma about chronic pain? Will this improve their leadership efficacy? And will this result in a change in work performance? Have you ever witnessed or experienced stigma around chronic pain in the workplace, in your workplace? Yes. Oh, 75% of us have frequently witnessed or experienced stigma, and a 25% of us has experienced it occasionally. This is huge. Can we have the next question, please? What would you need most to become more pain supportive leaders? Do you need more training, clearer policies, supportive organizational culture, or strategies for addressing stigma? Again, this is about your own needs. It doesn't have to be, everyone's needs. So we have a balanced distribution here. 25% of us need more training, 50% need more supportive organizational culture, and 25% needs strategies for addressing stigma. Thank you for participating in this poll. All right. So, as I said in the study, we just developed an evidence-based program, a leadership program to teach leaders about transformational leadership from a chronic pain perspective. So, we designed this as an online training which lasted an hour long, and it had 3 modules. So, in the first module, we only talked about the basics of chronic pain with leaders. We talked about what it is, what is the prevalence rates, what are the workplace implications, why it is important, what can be done about it. And after this 15 minutes, we just provided them a bunch of self reflection questions as well as interactive exercises. And then we moved on to the second module, which was about the basics of transformation leadership. So, transformation leadership 101, what it is, what is the definition, what are the example behaviors, what we know in the research, what we know in practice. So again, we repeated the practical side with a bunch of self-reflection questions, some goal setting, and some interactive exercises. And in the last module, we just mirrored module 1 and module 2, and we talked about chronic pain in the workplace and transformational leadership. So we talked about how can transformational leadership be applied in the chronic pain context. And as yes, you guessed it right. We did a bunch of self-reflection questions and interactive exercises afterwards. So this was the whole the whole training. It took an hour long, and again, that was purely an online training. And this slide shows more technical details about how we evaluated the effectiveness of this training program. So even before the training, we just recruited a bunch of leaders who were interested in this topic. We assessed their baseline stigma levels, their baseline transformation leadership behaviors, their baseline leadership efficacies, as well as their employees' performance level at the time. And by their employees, I'm talking about their employees with chronic pain. And 1 month later, we just gave access to the training program. A bunch of the 92 of those participants just participated in the training program that we designed. And another 84 of them, which I will just call as the control group, participated in another training of equal length and style about business communication. And we also repeated the survey following the training program. And then 1 month later, we did another follow up survey. And as you can see, we measured their stigma, transformational leadership, leadership efficacy, and their employees' job performance, the job performance of their employees with chronic pain 1 month later. And the questions that you just answered, those 8 questions about leadership behaviors, were actually the items that we use to assess transformational leadership. And we also assess stigma. By stigma, I'm talking about affective stigma, so how they feel about employees with chronic pain. Cognitive stigma, how they think about employees with chronic pain, and behavioral stigma, how they behave towards employees with chronic pain. And as you can see, examples here, an example statement of the affective stigma is I feel comfortable dealing with employees with chronic pain. An example of cognitive stigma is, and if an employee is suffering from chronic pain, it's his or her own fault. And the behavioral stigma was measured using a sample item like, I would avoid talking to an employee with chronic pain so that I don't have to deal with their problems. We also measured their leadership efficacy. And again, this is a fancy term that we use to refer to how confident they feel in showing leadership to employees with chronic pain. And lastly, as I said, we measured the job performance. And you see the results on the screen. So first, we looked at if we could actually make a difference in their transformational leadership behaviors through this training program. And the line that you see on top is it belongs to the training group, and the line that you see on the bottom is for the control group. And as you can see at the beginning of before the training program, they had similar, almost equal levels of transformational leadership behaviors. But after the training group reported much higher levels than the control group, and that although that those transformational leadership behaviors showed a decline over time, that was still significantly enough to conclude that the training program was effective in improving the pain-focused transformational leadership behaviors. And when we look at those facets or those specific leadership behaviors, we saw that the idealized influence, so being a role model, also increased as a as a result of this program, and inspirational motivation. So we were able to. That means we were able to um, uh, m- make leaders become more role models when it comes to pain. We also were able to encourage them to draw a more positive vision about chronic pain or living and working with chronic pain. But we could not see any significant changes in intellectual stimulation and individualized consideration behaviors. So that means the training program wasn't able to teach leaders to challenge their employees, and it was unable to teach them show even more personalized attention. And when we look at the stigma levels, we see that the training program was actually successful in reducing effective stigma. So that means the leaders who participated in this training program felt differently about employees with chronic pain as a result of this program. But again, we were unable to change their cognitive or behavioral stigma, which is surprising for me, to be honest, because I thought after sharing so much information and knowledge exchange, I thought their thoughts about employees with chronic pain would change, uh, but we could not see such a change. One of the very robust findings of the study was the increase in leaders' confidence in their ability to address chronic pain when they see an employee with chronic pain. But we did not see any changes in the employees' performance, and we can discuss why this happened. I still suspect that it is an outcome of our research design rather than a real change. So it's not because employees may not have improving performance, but it's probably because we were unable to detect it in the time frame that we had this study. All right, so let's understand the results. So let's discuss. Why did we not see an improvement in employee performance? Again, my guess is that, and of course, this is just post hoc justification probably, but like we were able to change, we were able to cause an improvement in employees, in leaders' transformational leadership behaviors as a result of this training program. But probably those behaviors were not shown long enough to cause a change in employees' performance. So we probably needed some more time so that leaders could demonstrate their leadership skills, newly acquired leadership skills and behaviors, and employees would notice it and translate it into improved performance. But also, as many of you also have indicated in the in one of the poll questions, maybe we need more systemic and organizational supports as well, not just the leadership support, but the organization should also be supportive of the whole um, employee chronic pain supportive behaviors. Because sometimes one leader is just one leader, but you need the larger structure to support the whole behavior. And also, I think employees may need direct interventions themselves other than leadership support. But of course, these are my justifications for the results that we saw. And maybe you have different opinions. And if you have, please share it in the chat box, and I'd be happy to read it out, to read it out loud. But in summary, I think this training program was effective. It changed leaders' behaviors. It broke affective stigma, at least, and it improved leadership efficacy, which I think was one of the most important outcomes of this program. Because when leaders feel confident, they would just make efforts to improve and to intervene on the issue. All right, so I'll just stop here and ask you about if you could use these findings in your own work, and how, or if you do not use them, maybe you can share why. These are just my answers, the answers that I came up with. But I think at least this is how I use these findings in my more practical work. I think these results tell us that we can advocate for leadership training in organizations. It can be this particular training program or another training program, but it doesn't matter. It's just we understood based on these findings that leaders actually might benefit from a specific training on leadership in the chronic pain context. Also, working with leaders to develop pain inclusive policies can be the next step of this study. So maybe we can just think about pain inclusive policies and involve leaders in developing them. Particularly if they are educated in this area, that would even be more helpful. And also, and I'm curious if there's any disability management professional in our group, and then I would be curious to hear about their comments. But applying transformational leadership principles in disability management could also be a useful outcome of this study. So if you're working with an employee who is returning to work, maybe just giving a very brief overview of transformation leadership behaviors, or having a quick exercise with leaders on how they can welcome their employees back. It could be helpful because, again, from research we know that return to work, particularly the first few months of returning to work after a disability leave, can be a critical time for employees to stay in the workforce and stay with the organization, and those transformational leadership behaviors can particularly come handy in those critical times. And again, I have more questions for you. And you can just type it in the chat box, or we can discuss it later on after the webinar. Or maybe you just want to answer those questions by yourself. But what specific action can you take to promote peer supportive leadership? What challenges do you foresee, and how can these challenges be addressed collaboratively? So these are my last questions for you as food for thought.
Thank you so much for this presentation. And as mentioned, I'll allow everyone time to put in some of those answers if they thought of some, or if there's questions that are coming out of today's presentation. Please know again, we have the chat that is open as well as the Q&A box. And I'll start with our first addition to the chat here. Education for leaders on return to work and transformational leadership appears to be one of the difficult practices in the industry. And she is speaking as someone as a disability management and vocational rehab specialist. The challenge is the leaders and organizational structures that are not open to these discussions. So looking to see what your thoughts are on that. And I think that endpoint is one of those sticking points. It's there isn't that openness to these discussions, to moving into different approaches and things. How can we look to get over those barriers and open up those conversational doors, if you will?
Thank you very much for sharing. Like, my experience is also in the same direction, but I'm just curious, if you don't mind typing more. Uh, why do you think the leaders and organizational structures are not open to these discussions? Why do you think this is, like, where is the barrier? What makes them and despite providing training to leaders on accommodations and human rights cause, what prevents them from showing an interest in more open dialogue?
But there's another thought in the chat around perhaps one of those reasons, in that leaders do not want to get involved in employees' medical situations. They simply don't want to know.
It's actually talking, like, pointing to the behavioral stigma, right? So when we go look back those items, the behavioral stigma item, and this is just a sample item, but I would avoid talking to an employee with chronic pain so that I don't have to deal with their problems. And yeah, I think the behavioral stigma, and we were like in this program too, we were unable to change it. We were unable to break it. And I'm just curious of your thoughts about your thoughts. If there's a way to break that behavioral stigma, because uh, like why they don't want to know what is going on in the background. Maybe we don't. Do we understand the leaders' perspectives, or like is it just they shy away, or if they don't trust in their own abilities? And Sarah said, in my experience, it is attitudinal barriers and learned understandings from personal experiences on what disability is and what it means, like stigma. Yep, attitudinal barriers. I agree. And also, like again, I was one of the thoughts that I had when looking at the results is that sometimes leaders may know how to behave and what to say in particular situations, because policies and procedures can teach them how to navigate those difficult situations. But sometimes those thoughts or behaviors may not be purely reflective of their own thoughts and attitudes, but sometimes it's just learned behaviors about navigating those challenges. So I think keeping the behaviors and attitudes or emotions separately and addressing them separately would be important. And I would just as a guess, uh, I don't have any data about this, but maybe we should also understand leaders with disabilities, because when they experience it from the first hand, they might perhaps have different attitudes. Thank you very much, Elizabeth. And you can see my contact information on the screen. So if you would like to reach out, I'm always happy to chat.
Okay, wonderful. And is there any last thoughts you would like to share about the future direction or how we can go over those barriers?
I think I would want to understand this stigma piece a little bit more about the cognitive stigma and the behavioral stigma. It will probably be my next step in my research efforts.
Okay, wonderful. Yeah, stigma is one of those conversation pieces that does arise again and again and again. And hopefully, we can work together through discussions like these and presentations like these to keep moving that needle in the direction we'd all like to see it go. So, once again, thank you so much for this very interactive presentation. And thank you to the audience for being an active participant throughout the entire session. We're very appreciative of your time today. I do see there's a last comment in the chat. I'll try to get to it before we close out. But I just want to remind everyone, as people may need to drop to their next meetings and things like that, that we have recorded this session. It will be available, and we will send all of those details in a post communication event email. So watch out in your inbox for that. as well as to our Work Wellness Institute members, that you will receive your free certificate of attendance from today's presentation. If you are interested in learning more about the Work Wellness Institute as a whole or about our membership, please visit workwellnessinstitute.org and email membership services at workwellnessinstitute.org if you do have any questions, as well as please feel free to peruse that website again to look at all of our full programming through our courses and resources sections. And hopefully we'll see you all again on April 9th, which is our next webinar on endometriosis and its impact on women's career progression. So once again, I would like to thank everyone for your time. And if I could ask one more poll for today, there will be an evaluation survey that pops up for you at the very end. So please do take a moment to complete that. We appreciate it. It's very quick, not many questions at all. And we really do utilize that feedback to continue our programming and making sure it's quality and relevant to our audience. So a final thank you to you all, audience, as I can see the chat is still running up with lots of great insights. And thank you to yourself too for being our leader in today's session.
Oh yeah, it's my pleasure. Thank you for having me.
Continue to learn and connect with the Work Wellness Institute and see how we're transforming research into workplace performance and health at www.workwellnessinstitute.org.